So critical reasoning question. So first is this is the passage Aeon passage. So a century ago, invention of a beating heart was off limits to doctors. Okay, so a century before, so invention of the beating heart was off limits of to doctor to the doctor to pass through its pulsating walls with scalpel or otherwise was seen as an uncharted expedition where risk of death for the patient was exponentially high. Theodore Billroth, an early innovator of modern surgery, allegedly remarked that no surgeon who wished to preserve the respect of his colleagues would ever attempt to suture a cardiac wound. No surgeon who wished to preserve the respect of his colleagues would ever attempt to suture a cardiac wound. And so early attempts at surgery on a living heart were conducted in situations where recklessness was deemed appropriate. In 1896, the first successful suture of the heart was performed on the stabbing victim who would have died if his surgeon, Ludwig Wren, had cared more about gaining the respect of his colleagues. Well, this essay success inspired confidence in the pioneers of heart surgery. Progress in cardiac surgery was dismally slow. Bypass procedure, where new pathways are successfully surgically created when arteries were blocked, were not trialed until the mid 20th century. Astonishingly, thoracic surgery, where lungs and chest are also involved, is seen as one of the most technically advanced field of medicine. Despite a majority of these advancements having been made over the relatively brief span of half a century, that such procedure was paid to the heart is reflective of more than just this, the that such prudence was paid to the heart is reflected age of more than just the physiological difficulty of operating on the powerful muscle responsible for circulating of our most vital fluid. It also represents difference to our passion and desires when the lover betrays us, we're heartbroken. Fits of rage, and anger are marked by our hearts pounding in our chest. When a potential mate flirts with us, we experience a flutter in our breast. Such psychological and sentimental attributes to the heart raised its significance beyond its circulatory function and established a taboo that was crucial in addition to anatomical. So here you can see in this passage some of the important question we can MCQ given. So what was the early perception of surgery on living parts? So it was early perception was it was considered too risky and it was considered taboo and high risky. Second question, it was who is credited with the first successful suture of the heart? So it is Ludwig Rehen. So we have read when were bypass procedure trialed in cardiac surgery? So in the mid 20th century. Okay. What is the nature of cardiac surgery? So it involves heart and lungs. Okay. Why is cardiac surgery considered one of the most technically advanced field of the medicine? Because it deals with both heart and lungs. So, and sixth question: what contributed to the significance of the heart beyond its circulatory function? Psychological and sentimental attributes that contributed to the significance of the heart beyond its circulatory function. How does the phrase "heartbroken" symbolize emotion? It represents feeling of betrayal or loss. So, phrase "heartbroken" symbolizes emotions. Here, it represents feelings of betrayal or loss. Why were early attempts at heart surgery considered reckless? The risk of death for the patient was very high. That's why. What remark did Theodore Billroth allegedly make about suturing a cardiac wound? because it should never be attempted by a surgeon. 10 question. What inspired confidence in the pioneers of heart surgery? The success of the victim first suture of a on a starving victim. Okay. Which of the following statements is supported by the passage? So here you can the answer see the answer. The first successful suture of the heart was performed in 1896. What was the main factors that led to delayed progress in cardiac surgery according to the passage? The high risk of death of the patient. High risk of death of patients. Which of the following best describe the significance of cardiac surgery? It deals with the surgery procedures on the heart and lungs. Okay. According to the passage, why were early attempts at surgeon on a living heart considered reckless? The risk of death of the patient is very high. That's why. What is the main reasons behind the significance attributed to the heart beyond its circulatory functions? So cultural taboos and sentimental attributes.